Guidance on this issue has just been published on the Scottish Government's website, and I want to tell you today what that guidance says. Before I do, though, I want to stress at the outset a very important point and ask you to bear this in mind. I'm talking here about face coverings made of cloth or other textiles, such as a scarf. I'm not talking about medical grade face masks that you would see health and social care workers wearing. The guidance that we are publishing today firstly makes clear that the most important step we can all take to prevent transmission of the virus is to comply with the current stay-at-home, social distancing and hygiene rules. Face coverings are not, I repeat, not a substitute for any of that. The guidance also makes clear that the evidence on the use of face coverings is still limited. However, it recognises that there may be some benefit in wearing a face covering if you leave the house and enter an enclosed space where you will come into contact with multiple people and safe social distancing is difficult. For example, on public transport or in shops. Of course, just now, most shops are closed, so right now this would apply in particular to food shops. Now, to be clear, the benefit comes mainly in cases where someone might have the virus but isn't aware of that because they're not experiencing any symptoms and therefore not isolating completely in line with the rules. So wearing a face covering in these circumstances may reduce the chance of that person transmitting the virus onto others. So the Scottish Government is now recommending the use of face coverings in these limited circumstances as a precautionary measure. Given that the evidence is relatively weak, we're not at this stage making this mandatory or suggesting that it will be enforced, though we will be keeping that under review as we go into future phases of managing and tackling the pandemic. And of course, it's worth bearing in mind that there are some people, for example, people with asthma, who might have very good reasons for choosing not to cover their mouth and nose when they're out and about. And we're not recommending the use of face coverings for children under the age of 2. However, to repeat, we are recommending that you do wear a cloth face covering if you are in an enclosed space with others where social distancing is difficult, for example, on public transport or in a shop. But let me emphasise the key point here, which is that you should not really be in situations very often like that right now if you are complying with the stay-at-home rules. Now, the guidance states that there's no evidence at this stage to suggest that there are benefits to wearing a face covering outside, except in unavoidably crowded situations. But again, we are keeping that aspect under review. The guidance also includes some information on how to safely apply and wash face coverings. When you're applying or removing the face covering, you should first wash your hands and avoid touching your face. And after each time you wear the covering, you must wash it at 60 degrees centigrade or dispose of it safely. The detailed guidance, as I've said, is available on the Scottish Government's website, and the guidance on the NHS Inform website will also be updated very soon. But the most important point I want to stress again is this one. The wearing of facial coverings is an extra precaution that you can, and we are suggesting you should take. It may do some good in some limited circumstances, but it is not, and it must not be seen as, a substitute for the other rules and guidelines that we have been stressing and asking you to comply with. In particular, anyone with symptoms of COVID-19 and all members of their household, regardless of whether or not they have symptoms, must self-isolate. Guidance on that is already available on the NHS Inform website. And physical distancing, hand washing and respiratory hygiene, covering up coughs with disposable hankies or even with your sleeve, remain the most important and effective measures we can all adopt to prevent the spread of the virus. So please, above all else, continue to follow the rules that we have set out. Stay at home, except for essential purposes such as buying food or medicine or exercising. If you do leave the house, you should stay 2 metres apart from other people, and you should not meet up with people from other households. And of course, you should wash your hands regularly and thoroughly. I know, as I say every day, but every day it becomes ever more true that sticking to these rules is really, really difficult, but it remains essential. It is how all of us can help to continue to slow down the spread of the virus, continue to protect our NHS from being overwhelmed and continue to save lives. So thank you for sticking with it, and please continue to do so.